Tendonitis is by far probably the number one thing I see in the office.
Okay.
Some cases, and when I say cases, people like in their elbows and back are just easier to fix, and some are not. Some might take 2-3 visits. Some might take 23. No, I don't know.
Mm-hmm.
I just don't know until we get to that point.
Okay.
So what we'll do is, let me pull this up for you. Let's talk about the elbow and the ulnar collateral ligament, which is the UCL, which is this ligament here.
Mm-hmm.
You see this a lot of baseball players, and that's where when we had you come down in this type of issue, like it kind of tested you as if you were kind of like a baseball player. That was you felt the pop in there. So I think there's a little bit of laxity in there.
Okay.
I don't think I can correlate it 100%, and I'll tell you my theory.
Okay.
And so when I say theory, what I'm really saying is like I'm kind of going based off of like, this is what I think is happening. If what I think is happening and we do a treatment approach that is proven or research done, and we apply A to B, we should see result C.
Okay.
Meaning you should get better,
Okay.
right? If we're not doing that, we have a couple other variables. Are you training too much? Are you training too little? Is my theory wrong? Is it a stubborn case? What's going on?
Okay.
I think, in my opinion, is like you had pretty good range of elbow stuff or shoulder. They were pretty close. I don't think I can correlate that at this point in time, but I do think there's a little bit of laxity in that elbow comparatively to the other one. What does that mean? It just means there's a little bit more movement in that side. Not a lot.
Okay.
It's not torn. It's not messed up. It's not like you did anything to it. It's not like you threw a left-handed fastball 900 miles an hour and like heard it pop.
Right.
It's nothing like that. But maybe what happened is, as a result of all that, and by the way, all your job in terms of like all the pull-ups and you know, stuff that you've been doing, is that the flexor tendons also have a common attachment point, which is right here. That's why I kept like focusing my fingers, like, oh, you feel it there? So it's like this is the common spot where all the flexor tendons actually attach to. And so for some reason, this side is working more than this one. And my theory is that because there's a little bit less stability on that elbow, because you do such an aggressive type of movement, like you're powering through it, this elbow has a little bit less stability. And so what's happening is I think the muscles around there are tightening up and creating a tendonitis.
Okay.
Let's talk about tendonitis. Tendonitis, by definition, is inflammation of the tendon, obviously. And so when we look at this type of stuff right underneath a microscope, you're actually going to see inflammatory cells, which really just means you're going to see a whole host of, you know, immune system cells and stuff like that. A tendinopathy is totally different. A tendinopathy is degeneration of the tendon. Basically, and when that sounds like a worse word than it really is, imagine taking a rope and just like kind of pulling this rope back and forth, back and forth, back and forth. It's going to start to have a couple little frays, just like a rope, you know? So think about that rope. It's going to fray a little bit. So what you're really doing is getting, like, if I kind of did this to your shirt, it would fray off a little bit. We can cut away the frays. The body's self-healing, so it can kind of re-stimulate to heal. You just need to do the right things.
Okay.
There's a lot of research on this stuff, and we'll talk about this stuff. I mean, a ton of research on this stuff. And so a lot of things you could do is everything from supplementation to loading strategies, which is meaning like rehab, what you should do, what you shouldn't do for rehab, like all this other stuff, and a lot of manual work should be better. I don't think popping or clipping or adjusting you will fix this. Period. In my opinion, we need to actually stabilize the elbow joint, but at the same time mobilize the soft tissue around it. There's a reason also why I think you find a lot of results with let's kind of zoom this out, with the elbow, is because like a lot of times like when you're kind of like doing this type of like elbow work, you're really contracting this, and then like that anconeus and that muscle right here, actually that being released helps the whole joint itself.
Okay.
So
Do you
basic.
think that this being less strong leaves room for like that movement? Because this one's more solid, so it just like my rotator cuff You saw how it was weak, right?
A little bit,
Okay.
but it was very close to the other side.
Okay, well that's good because it wasn't.
It was very close to the other side. Like,
Uh-huh.
I think if we had anything to do,
Uh-huh.
we could probably improve your strength within the subscap, which
Okay.
is the muscle that does more internal rotation.
Yeah.
And I think what we could do is also show you like some good shoulder stability stuff. Because
Yeah.
worst comes to worst, right? Let's just say worst comes to worst. We're treating it as if there's a shoulder and an elbow issue at the same time. We're covering all our bases versus just treating just a shoulder issue. So what I'll do is I'm going to show you an exercise, an advanced exercise that's actually going to help you with everything versus just one.
Okay,
Like, I'm not going to
cool.
just show you just like a bicep curl
Yeah.
or just a band inside outside. You already know that stuff. Let's just show you something a little bit more advanced because you're doing advanced work in there. But I think in your case, it's a good old fashioned of tendinopathy. Tendinopathies, if you look at the microscope underneath them, they actually don't have inflammatory cells inside of there, which is very unique.
Oh, okay.
So it's kind of really cool.
Okay.
So one is tendonitis can lead to a tendinopathy, but a tendinopathy is pretty much a tendonitis that just went lingering on for a while.
Yeah.
So it's kind of like the little guy who went stray off the path.
That's how I feel.
And they typically can take. I mean, I would say I see a crap ton of elbow tendinopathy and then a crap ton of tendinopathy here in the patellar tendon, runners, jumpers.
Yeah.
You don't really see a lot of tendinopathy elsewhere. You really see it in the elbow and the knee.
So you said typically it takes anywhere from.
I don't know how long it will take.
I know you don't.
But so what I will say to you is what we want to do is focus more on not necessarily timeline as we do want to do checkpoints, right?
I know.
Think about it like if you want to do a pull-up, the first thing you have to do is like be able to like get on the bar and hold yourself up there.
Yeah.
Then you have to be able to like contract your shoulder blades, then do a pull-up, right? Or get half a pull-up. Like, I don't want to tell you a timeline because it might be faster, it might be slower. What I want to do is see the pain reduction come down and still maintain your fitness.
Yeah.
If you, like, a lot of people will tell you rest is the best thing for this. Absolute bullshit.
Really?
Absolute bullshit. You need to have loading strategies and what I call like fitness exercises. You need to be able to stress the tendon so it can lay down more collagen.
Okay.
So think about it like building a house or an apartment or building a room. Like, you wouldn't just like, it wouldn't just pop up. It's not going to build itself. You need to build the scaffolding, and the scaffolding has to be filled in by sheetrock and all these other construction materials, and then it can be produced to a house. You can't just like let this living tissue that is supposed to be healthy work and not work it and then expect it to get better.
Got it.
Like, it had, like, especially if you wanted to sit on the couch, you'd be fine.
Yeah.
But
Right.
but that's not what
I
you're
know.
going to be doing.
And I've kind of just been doing this fitness route by myself. So I'm kind of glad I'm here because I don't really know everything I'm doing. Like before, like a year ago, I was working, actually, I want to say before COVID, I was working 9 to 5, you know?
Yeah.
And it was just like my hobby. And then after COVID, I quit, and I'm just kind of like going full force into my fitness, and I feel like I'm kind of going in blind, so I need a little more guidance.
I think you've done a great job. Like, you have a good amount of balance. Like, there's no nerve issues.
Yeah.
And when I show you the nerve issues, like, what I was really trying to do, let's just get rid of the muscles so you can see. I was literally trying to pull down on all these nerves on the median nerve, and this is the ulnar nerve that you said that you defined.
Yeah.
And I think it's just because when you do this, you're getting a good amount of stretch through here, but this is staying stable. So, what tells me is like there's a little bit of, I won't call it laxity. It's just like there's a little bit of that shift, not much. But when you do this, like a baseball player, you kind of have to like rotate on that angle right there, and that's what causes like a little irritation there.
Yeah.
So, but it's also the common attachment point right there. But I don't think it's a nerve issue either.
Okay.
And I remember when I said like I feel like the nerve is in the right place. There's the groove right there. Sometimes the nerve can kind of like slip out. I was actually feeling for that like right there, like to see if it was like, that's why I kept going like this. Like,
Oh my gosh, is that painful?
It can be painful, but what's more painful is like the fact that imagine a nerve that's supposed to be protected in this area is now like popped out and it constantly gets irritated, and so now it's kind of like
so it's not that.
it's kind of like popping over this bone all the time.
Yeah, I was worried it was something like that.
No,
Okay,
I don't
good,
think so.
good.
So you're pretty much dealing with an old-fashioned tendinopathy.